بسم الله الرحمن الرحيم. هنبدأ بشابتر 14 Viral Diseases 14th edition of Android. راح نشرح في هذه المحاضرة عن جزء من الهربس زوستر. Varicella zoster virus, zoster, shingles, herpes zoster, and the human herpes virus type 3. Zoster is caused by reactivation of Varicella zoster virus. Following primary infection or vaccination, Varicella zoster virus remain latent in the in the sensory dorsal root ganglion cells. The virus began to replicate at some times later, traveling down the sensory nerves into the skin. Immune suppression, including use of tumor necrosis factor inhibitor, justus kinase inhibitor or JAK inhibitors, rituximab, sphingosine 1 phosphate modulators, and other immune suppressive agents. Certain cancer therapies, HIV, and age-related deficiency of cell-mediated immunity are some of the most common causes of the zoster. يعني immune suppression بهذني الأسباب اللي ذكرناهن. Iatrogenic immune suppression can confer an increased risk of zoster based on the type of the drug combination of agents. Drug-specific attributable risk in the is an area of active investigation. NTB cell therapy, JAK inhibitors, targeted synthetic agents, and biologics confer an increased risk and consideration for pre-treatment vaccination is warranted. هذول البيشنت اللي ياخذون هذا التريتمنت ممكن نعطيهم قبل ما نبدي لهم هذا العلاج نبديهم vaccination. A family history of zoster is associated with an increased risk of developing zoster, suggesting a genetic risk component. Patients on hemodialysis and those with comorbidities have increased risk of zoster. Zoster risk may be mildly associated with cholesterol level, and statin use also slightly increase the risk of the zoster. And zoster patients are more likely to subsequently diagnose with a malignancy, especially hematologic malignancy, with an absolute risk for the cancer of 0.7 to 1.8 at 1 year after zoster. The incidence increase with age. إذن هسه ساعتنا immune suppression, family history, cholesterol level and statin use malignancy ممكن associated أو يعني هي من immune suppression بس ممكن develop malignancy later on and increase with age. Under age of 45 years, the annual incidence is less than 1 in 1,000 persons. Among patients older than 75, the rate is more than 4 times greater and هذول اللي بالنسبة اللي ذكرناهم. For white persons older than 80, the lifetime risk for developing herpes zoster is 10 to 30%. Women appear to have a higher risk than men. Overall, about 1 in 3 unvaccinated persons will develop herpes zoster. For unknown reason, being non-white reduces the risk for herpes zoster, with a black persons 1/2 to 1/4 less likely to develop zoster. إذن إنه الوايت بيرسون إضافة إحنا مثل ما ذكرنا هو ممكن أكو family history فممكن genetic يعني causes that تلعب دور. Autoimmune disease, asthma, diabetes, and chronic obstructive pulmonary disease are associated with increased risk. Immune suppression, especially hematologic malignancy and HIV infection, dramatically increase the risk for zoster. In HIV-infected patient, annual incidence is 3 in 1,000 persons, or annual risk is 3%. With the universal use of varicella vaccination and the decrease in the pediatric and adolescent varicella cases, older persons will no longer have periodic boosts of anti-varicella zoster virus immune activity. Theoretically, this could result in an increase the incidence of zoster, although this is not yet being observed. Incidence increase, but is attributed to aging populations, and widespread adoption of zoster vaccine will impact the epidemiology of the disease. هاي آخر فقرة دا يقول إنه إحنا لما قلنا نستخدم يعني الفاكسينيشن للأطفال فبالتالي الأولد بيشنت أو يعني الكبار بالعمر ما راح يتعرضون البوستر دوز من الفارسيلا زوستر فيروس لأنه هم لما يعني مثلا يكونون كونتاكت ويا مثلا طفل مريض راح يقوي لهم مناعة كأنه مثل دا ياخذون لقاح. فيقول يعني دا يذكر إنه theoretically إنه هذا ممكن المفروض على أساس إنه يزيد الريسك مع الهربس زوستر بالأدلت أو بالأولد إيج. بس إنه يقول لا، إنه هذا مو هو السبب. السبب هو صح زاد، بس السبب بسبب aging populations. يعني إنك شلون خلينا نقول إنه عادة يعني الشعب أو يكون الأولد إيج نسبة عالية، فبالتالي راح تزداد نسبة الزوستر لأنه البيشنت يعيشون عمر أطول. زين. Herpes zoster classically occurs unilaterally within the distribution of the cranial or spinal sensory nerves, often with some overflow into the dermatomes above and below. ممكن يصير شوية فوق and below this dermatome. The dermatome most frequently affected are the thoracic, 55%, cranial 20%, with the trigeminal nerve being the most common or single nerve involved, lumbar 15%, and sacral. إذا عندنا cranial أول شيء thoracic, cranial, lumbar and sacral، يعني تقريبا بالتسلسل، عدا إنه thoracic صايرة قبل الcranial، هاي جاي عليها MCQ. The cutaneous eruption is frequently preceded by one to several days of pain in the affected area, although the pain may appear simultaneously or even after the skin eruption, or the eruption may be painless. ممكن إذا الألم يجي قبل الإرuption، خلال الإرuption، أو بعد الإرuption، أو ممكن يكون أيضا painless. The eruption initially present as papules and plaques of erythema in the dermatome. Within hours the plaques develop a blister. إذا بالبداية ممكن تجي على شكل papules or plaques، ممكن بعدين تصير blistering. Lesions continue to appear for several days. The eruption may have a few lesions or reach total confluence in the dermatome. ممكن few lesion أو إنه يصير يعني يصير تجمع كمية كبيرة من الفيسيكلز بالدرماتوم اللي affected. Lesions may become hemorrhagic, necrotic, or bullous. Rarely the patients may have pain, but not no skin lesions. يسموها zoster sin heredity. sin يعني بدون. zoster sin heredity. Pain severity correlate with the extent of the skin lesions, and elderly persons tend to have a more severe pain. In patients under the age of 30 years, the pain may be minimal. Scattered lesions occur outside the dermatome, usually fewer than 20. In the typical case, new vesicles appear for 1 to 5 days, become pustular, crust, and heal. بداية بدي أشكل pustules أو قلنا papules وراها pustules وراها crustation and healing. The total duration of eruption depend on the 3 factors اللي هي patient age. كل ما يزداد الage كل ما إنه تزداد ممكن ال duration, severity of the eruption, the presence of underlying immune suppression. In younger patients, the total duration is 2 to 3 weeks, whereas in elderly persons, the cutaneous lesions of zoster may require 6 weeks or more to heal. Scarring is more common in elderly and immune-compromised patients. Scarring are also correlate with the severity of the initial eruption. Lesion may develop on the mucous membrane within the mouth, in zoster of the maxillary or mandibular division of the facial nerve, or in the vagina with a zoster of S2 and S3 dermatome. هاي هنا صورة على mucous affection, mucous membrane affection. Zoster may appear in the recent surgical scar and may follow injection of the botulinum toxin. Zoster may rarely be seen in children under the age of 1 year. This can result from intrauterine exposure to Bacillus zoster virus or exposure to Bacillus zoster virus during the first few months of life. The maternal antibody still present results in muted expression of Bacillus, subclinical or very mild disease. The immaturity of the infant's immune system results in poor immune response to the infection, allowing for early relapse in the form of zoster. إذا البيشنتس اللي هم يجون نيونيت أو يعني infant وصاير عندهم هيربس زوستر، هم أما ماخذي intrauterine أو يعني إنه after birth صار عندهم within few months of life، فما راح تبين عليه الأعراض مال chicken pox لأنه عنده maternal antibodies، بس بنفس الوقت مناعته ما راح تكون قوية حتى تكون يعني حتى تكون مناعة، يعني إنه حتى تكون إنه يعني memory cells للفيروس، فبالتالي إنه إذا تعرض مرة ثانية ممكن إنه يعني ممكن يصير له ري اكتيفيشن لان هو مناعته ضعيفه. يعني هو صح بالبدايه صارت عنده ترانس بلاسنتال انتي بوديز، بس هذه ممكن بس خففت البارسيلا زوستر البارسيلا. بس الهربس زوستر راح يكون يظهر لانه هو الطفل نفسه مناعته ضعيفه. هسه عندنا disseminated herpes zoster. Disseminated herpes zoster is defined as more than 20 lesions outside the affected dermatome. It's occur chiefly in the older or immune suppressed individuals, especially in patients with hematological malignancy or AIDS, as we talk about it in the previous slides. Low level of serum antibody against Varicella zoster virus are highly significant risk factor in predicting dissemination of the disease. The dermatomal lesions are sometimes hemorrhagic or gangrenous. The outlying vesicles or bulli, which are usually not grouped, resemble varicella and are often applicated and may be hemorrhagic. Visceral dissemination ممكن يصير لللung, liver, and CNS in cases of disseminated zoster. Treatment, careful evaluation and systemic antiviral therapy. ممكن نبدي بالintravenous acyclovir then change to oral antiviral agents once visceral involvement has been excluded and the patient has received at least 2 to 3 days of intravenous therapy. إذا إحنا نعطي intravenous acyclovir شو وقت نوقفه لما إحنا إنه متأكدين إنه ماكو visceral involvement، وبنفس الوقت البيشنت أخذ intravenous acyclovir at least 2 to 3 days. Ophthalmic zoster. In cases of Herpes zoster ophthalmicus, the ophthalmic division of the fifth cranial nerve is involved. If the external division of the nasociliary branch is affected with the vesicles on the side or on the tip of the nose, يسموها Hutchinson sign. The eye involved in 76% of the time compared with 34% when it's not involved. يعني لما involved the ciliary branch or nasociliary branch, the external division مالته راح تتكون عندنا الهاتشسون ساينز اللي هي الفيسيكلز اون ذا تيب اوف ذا نوز، اضافه الى الاي انفولفمنت راح يزداد الريسك مالتها. هاي عليها اثنين امسكيوات. Vesicles on the lid margins are virtually always associated with ocular involvement. In any case, the patients with ophthalmic zoster should be seen by ophthalmologist. Systemic antiviral therapy should be started immediately pending ophthalmologic evaluation. Ocular involvement is most often in the form of uveitis and keratitis. Less common but more severe complications include glaucoma, optic neuritis, encephalitis, hemiplegia, and acute retinal necrosis. But most common هي uveitis 92% والkeratitis 50%. These complications are reduced from 50 of the patients to 20 to 30% with effective antiviral therapy. Unlike the cutaneous lesion, ocular lesion of zoster and their complications tend to recur, sometimes as long as 10 years after the herpes zoster episode. Other complication ممكن يصير عندنا motor nerve neuropathy occur in about 3% of patients with zoster. Others 3 times more common if zoster is associated with an underlying malignancy. About 75% of patients slowly recover, leaving 25 with some residual motor deficit. Thoracic zoster may be associated with motor neuropathy of the abdominal muscle, resulting in the bulge of the flank or abdomen called post-herpetic pseudotumor. لأن راح يصير bulge فيسموه pseudotumor. If the sacral dermatome S3 or less often S2 or S4 is involved, urinary hesitancy or actual urinary retention may occur. Hematuria and pyuria may be present. Prognosis is good for and complete recovery. إذا ممكن يجي urine hesitancy or urine retention, hematuria and pyuria بس البروجنوسيس مالتها good. Similarly ممكن يصير pseudo obstruction بالGIT يسوي لنا colonic spasm, dilatation, obstipation, constipation, and reduced anal sphincter tone can occur when the thoracic part اللي هو T6 to T12 or lumbar or sacral zoster ممكن يسوي لنا الGI أو pseudo obstruction والريكفري أيضا complete. Maxillary and mandibular alveolar bone necrosis may occur in about an average of 30 days after zoster or maxillary and mandibular branches of the trigeminal nerve. Limited or widespread lesions of the teeth, limited or widespread loss of the teeth may result. رمسي هاند syndrome, herpes zoster oticus, أيضا عليها MCQ, result from involvement of the facial nerve and auditory nerve by Bacillus zoster virus. Herpetic inflammation of inflammation بالgeniculate ganglion is thought to be cause of this syndrome. فالفيتشرز معناتها راح تكون zoster of the external ear or tympanic membrane, herpes auricularis with ipsilateral facial paralysis, herpes auricularis facial paralysis, and auditory symptoms. Auditory symptoms include mild to severe tinnitus, deafness, vertigo, nausea, vomiting, and nystagmus. Herpes zoster can be associated with delayed complications, many of which are caused by vasculopathies affecting the CNS or even the peripheral arteries. There appears to be an increased risk for both ischemic and hemorrhagic stroke within the first 3 months after zoster, which phase by 1 year. ممكن delayed contralateral hemiplegia simulating cerebrovascular accident stroke is rare but serious complication of herpes zoster that occur weeks to months. I mean about 7 weeks after an episode of zoster affecting the first branch of the trigeminal nerve. By direct extension along the intracranial branches of the trigeminal nerves, Bacillus zoster virus gain access to the CNS and infect the cerebral arteries. Patients present with headache and hemiplegia. Arteriography is diagnostic, demonstrating thrombosis of anterior or middle cerebral artery. This form of vasculopathy can occur after varicella, and many maybe the cause the cause of up to 1/3 of ischemic stroke in children. ممكن 1/3 of ischemic stroke هي بسبب varicella infection or varicella zoster infection of the or affection of the vessel. The recognized vasculopathic complication of Bacillus zoster virus has been expanded to include change in the mental status, aphasia, ataxia, hemisensory loss, and both hemianopia and monocular visual loss. Monocular visual loss occur in up to 6 months after zoster. Aneurysm, subarachnoid or cerebral hemorrhage, carotid dissection, and even peripheral vascular disease are other recognized forms of Bacillus zoster vasculopathy. The vasculopathy may be multifocal and involve both large and small arteries. In more than 1/3 of cases, Bacillus zoster vasculopathy occur without rash. MRI, magnetic resonance imaging, is virtually always abnormal. The diagnosis is confirmed by PCR, anti-Bacillus zoster immunoglobulin G antibody testing of the CSF. Because this is caused by active viral replication in the vessels, the treatment is intravenous acyclovir 10 to 15 mg per kg 3 times daily for a minimum of 14 days. In some patients, months of oral antivirals are given if symptoms are slow to resolve. A short course of systemic corticosteroid is also given in some cases. Bacillus zoster has been linked to giant cell arthritis theoretically through similar mechanisms, although the data are mixed and the association is controversial. Once the recent meta-analysis has suggested that an increased risk of cardiac event associated with herpes zoster as well.